Hi, I'm Dave Katz with Katz Consultants, and I have a tip for you. You know, the last couple of weeks we've been talking about kind of falling down on the job, some of the things that chiropractors should be doing that they're not doing, and I have another thing that I think you might be falling down on the job with, and that is making sure that you reprocess a patient if they restart care with you. We had a rule in our clinic that anybody that hadn't been in for 6 months was automatically put in a consultation room instead of in our adjusting room, and that alerted me to the fact that I probably better do a follow-up consultation and probably a follow-up exam and maybe some x-rays. And it made a lot of difference in the treatment of the patients, because if a patient hasn't been in for 6 months or a year and a half, and you just take them in and do an adjustment on them, chances are you're not doing them the best care, you're not giving them the best care you could, and chances are you're not seeing the revenue that you should either. Because a lot of times if a patient hasn't been in for a year and the staff would put them in the consultation room, when I went in there I found out it would be a different problem. And I would take a briefcase history, I would do an exam, I would take the x-rays, and I would treat and charge accordingly. So why don't you set a rule in your clinic that if a patient hasn't been in for 6 months, you automatically put them in the area where you do the exam somewhere other than the adjustment room, and that way will alert you to the fact that you have to kind of do a follow-up procedure on this patient. This is Dave Katz. Thanks for listening.